So how many of you out there are looking for answers for your lower back pain? I've got the solution. Stay tuned. So we got my buddy Albert over here and his spine, and really it's some important muscles. Everyone worries about the core muscles. Part of the core system is actually some smaller muscles called the multifidi. And I've looked long and hard and really tried to find ways to trigger this muscle. And what I found here is that these muscles, they go up 1 or 2 or 3 segments above, and they're no bigger than my thumbnail. And they're really small, but they're so important to keep the vertebra snug so it don't shift around. So these are for our patient population here that are unstable, and usually things are popping all the time or jolting all the time, and these are the things that we want to take care of. So we want to be able to get this muscle to help stabilize the spine. What happens here is sometimes like if you really look here, these things will shift. Let's take this segment for instance, and this sucker is just getting shifted all the time. So this muscle here is just gonna then pin these things down, and you're gonna avoid that extra unstable movement. So how do we get this muscle to work, right? Everyone's, so like I said, so focused on the obliques and the transversus abdominis, but we got this great exercise coming. We have Tim, my intern. He's gonna help us demonstrate how to do this exercise properly and get this muscle stronger. And that actually should help even your planks and your core. And you find yourself shaking and wobbly all the time, this weakness could be part of the reason. So stay tuned. All right, so just like we spoke about in the introduction, we want to get the multifidi muscles. And if you just kind of see over here, the multifidi muscles, they actually line the side of the spine, just like I mentioned in the introduction. But what happens is sometimes you'll see someone with a lot of tone, these paraspinals, they're always just on fire, they're always being used. So we want to really re-educate these muscles, these multifidi muscles. They're so small, but I always tell people they're like the pillars of like Roman pillars, to just kind of stop the walls from collapsing. So what's supposed to happen here, opposite multifidi, usually it respond in the ability to do the opposite leg. So this stabilizes this side and vice versa. This stabilizes this side. So let's take a look at this side on Tim. And what we want to do here's the cues for the lift off exercise. You want to make sure, if I have a bird's eye view, he doesn't shift this way and he doesn't rotate like, a dog trying to, go to the bathroom on a fire hydrant. So let's go ahead and just slowly lift. And I tell people, your goal is just lift the knee here. Yep, and hold. And you can see over here, he doesn't have that much sway. A great thing I like to have is a dowel here. And you can see that if he does that, that's pretty good. So if you're having difficulty, you're finding yourself swaying too much, let's go ahead and drop that a little bit here, Tim. What we do is, I like to tell people it's a percentage game. So right now, it's 100% on the table, his right knee, that's the target. So we wanna move to 5% off. So just de-weight it. And what I mean by de-weight is your knee's still on the table, but you're just kind of taking the weight off. And you can move in 5% increments. And so let's see if we can really make it even more stable for Tim. So go ahead and move up to 10%. And that looks good, 15%. And he's using the opposite multifidi muscles for the right leg. Good. And then do 20%, 30%, 40%. And it's starting to get tougher on him. I could be really meticulous on this and really nitpicky on this for him, but go ahead and bring this back up. Yeah, you feel that? But let's try the other side. Let's see what happens on this side. So this would be his left leg, and you can kind of see, let's try a little bit by little. Try 5%. Move it to the next 5. 10, 15. So, and you can see right here, he's starting to kind of sway. You can see him shaking right here through his body. And that's good if I want to be really nitpicky. So my athletes I really care about, my 90-year-old, grannies and grandpas, I'll let it slide a little bit. So that's usually what I care about. So this is, kind of a little cue, but we can use that or we don't have to. The next progression to this, if you can really do it, let's go back to this side. This side is much stronger, right? Would you agree, Tim?
Mm-hmm.
Yep. Is just bring this up to 100%. That's when the knee actually goes off. You don't shift, you don't sway, and then you can try to drive this heel all the way towards the back wall. And you only go as far as you can keep this stable. So go ahead and try that. Good. And right about there is about when he starts almost about the dips. If you go a little further, let's show everybody. Go a little further back. You see how he's starting to rotate. Rotating down, he drops that side. People do this exercise wrong at the gym all the time. So let's really be hyper selective and hyper vigilant of these muscles. So this is the lift off exercise and doing it correctly. You want to avoid sway, that's one of them, and you want to avoid rotating. You want to keep everything flat like a tabletop and really just start as percentages. So those are your cues to do this exercise correctly and do it safely. All right, there it is. You know, Tim did a great job with the lift off exercise. It's a great exercise. These small muscles overlooked all the time. These multifidi muscles cinch these vertebrae up, make it important for life. Make sure you double check with your healthcare professional. Make sure it's the right exercise for you, but I think everyone needs it. I've been testing it and playing around with this exercise for years, and this is, I think, one of the keys to getting that core jump started. I think it's part of that core system, that ability to initiate and protect your back through all lifting motions. So give that a shot. Please let us know how it is, and if you're doing things correctly and if it's actually making improvements. Leave a comment below. If you like what we're doing, please subscribe to our channel, youtube.com/rehabrevive. And if you have any questions or suggestions, you could also email us at rehabandrevivemedia@gmail.com. I'm Dr. Lin of Rehab and Revive. Remember, we can and we will get better together.